What happens to your body when you have a stroke? 7. Warning signs to watch for strokes are one of the leading causes of death worldwide. And while many people understand the severity of a stroke, they often fail to recognize the subtle warning signs that may occur weeks before it happens. These early indicators, although sometimes easily overlooked or mistaken for minor issues, can be crucial in preventing a life-threatening event. In this video, we will explore 7 key signs that your body might give a month before a stroke and what you can do to prevent it. 1. High blood pressure, a silent killer. High blood pressure, or hypertension, is a primary risk factor for strokes. Blood pressure is the force exerted by the blood against the walls of your arteries, and when it remains high over time, it can cause significant damage to your blood vessels. This can lead to a weakened vessel wall that may rupture, causing a hemorrhagic stroke, or it may reduce blood flow to the brain, increasing the likelihood of an ischemic stroke. Scientific evidence. According to the American Heart Association, people with high blood pressure are more likely to suffer from strokes, as the constant pressure on blood vessels can cause them to become narrow and less efficient at delivering oxygen-rich blood to the brain. If you have high blood pressure, it's essential to monitor it regularly and follow your doctor's recommendations for lifestyle changes and medication. Small changes like reducing salt intake, exercising regularly, and reducing alcohol consumption can make a significant difference in controlling blood pressure and lowering stroke risk. 2. Fatigue. Unexplained and persistent. Tiredness. Fatigue is often seen as a common symptom of a busy lifestyle, but when fatigue becomes excessive and is not explained by a lack of sleep or physical exertion, it could be a warning sign of an impending stroke. This type of tiredness may be linked to changes in blood flow to the brain or narrowing of arteries due to atherosclerosis. Real-life example: a study published in Stroke Journal found that sudden fatigue could precede a transient ischemic attack, TIA, also known as a mini-stroke, which can occur when blood flow to the brain is temporarily blocked. TIAs may resolve on their own, but they are often a precursor to a full-blown stroke. If you're feeling unusually tired without a clear reason, it's important to see a healthcare provider for a full evaluation. Early detection of a TIA can prevent a more serious stroke in the future. 3. Vision problems. Blurry or double vision. Vision disturbances such as blurred or double vision can be a serious warning sign that a stroke is near. These symptoms occur due to problems with blood flow to the brain, particularly affecting the areas responsible for visual processing. Evidence-based fact. According to the National Stroke Association, vision problems before a stroke may occur because of blockages in the arteries supplying blood to the eye, signaling a lack of oxygen-rich blood reaching the brain. If you experience sudden vision changes, it's crucial to seek medical attention immediately. Even though vision problems can be caused by other conditions, it's better to err on the side of caution, as early intervention can make a significant difference. 4. Numbness or weakness in one side of the body. One of the most common signs of an impending stroke is sudden numbness or weakness, particularly on one side of the body. This might affect the face, arm, or leg. The loss of sensation can be brief, lasting only a few minutes or hours, but it is not something that should be ignored. Scientific support. A study published in Neurology highlighted that transient numbness or weakness on one side of the body is often an early indicator of a TIA or ischemic stroke. This occurs when a blood clot temporarily blocks the blood flow to the brain. If you experience any sudden weakness or loss of sensation, seek medical help immediately to determine whether a stroke is imminent. Speech problems. Difficulty speaking. Clearly, a person who is about to have a stroke may experience sudden speech difficulties, such as slurred speech or the inability to form coherent sentences. This condition, known as aphasia, is often a direct result of impaired blood flow to the areas of the brain responsible for language. Real-life example. Studies have shown that speech impairments are a common warning sign of strokes, particularly in the case of left-sided brain damage, which controls speech and communication. If you notice difficulty speaking or understanding speech, it's vital to seek medical attention right away. This could be a sign that a stroke is imminent. 6. Severe and sudden headaches. A sudden, intense headache, especially one that is unlike any you've had before, could signal a stroke. While not all headaches are related to strokes, they are often associated with a hemorrhagic stroke, which occurs when a blood vessel in the brain bursts. Scientific evidence. A study in The Lancet reported that people who experience sudden, severe headaches might be at a higher risk for having an aneurysm rupture, which can lead to a hemorrhagic stroke. If you experience a sudden and severe headache, particularly if it is accompanied by nausea, vomiting, or vision changes, seek immediate medical care. 7. Other neurological symptoms: dizziness, nausea, and memory loss. In addition to the more common symptoms listed above, there are other neurological signs that may indicate a stroke is approaching. These include dizziness, trouble with balance, memory problems, and even nausea and vomiting. Evidence-based insight. According to the National Institute of Neurological Disorders and Stroke, NINDS, balance issues and memory loss can occur due to a disruption in brain activity caused by a lack of oxygen. These symptoms can be temporary, but they should never be ignored. Conclusion. Prevention is key. The signs listed above may seem subtle, but they could indicate that a stroke is imminent. Understanding these symptoms and acting quickly could save your life. The most important factor in preventing a stroke is managing your overall cardiovascular health. Regular exercise, maintaining a healthy diet, controlling your blood pressure and cholesterol levels, and avoiding smoking and excessive alcohol consumption are all crucial steps in reducing your stroke risk. By staying proactive about your health and seeking medical advice at the first sign of any unusual symptoms, you can reduce your chances of experiencing a stroke and live a longer, healthier life. If you found this video informative, make sure to like and share it with your friends and family to help raise awareness about stroke prevention. Stay healthy and take care of your brain.